This is a parietal bone. The parietal bone is quadrilateral in shape and it is axial bone, flat and membranous bone. It has external surface, internal surface, superior border, inferior border, anterior border, and posterior border. The external surface has parietal tuberosity. It has importance. What are the importances? It is the commonest part where the fracture of the skull can occur, and the ossification of the bone starts from here. And also it is the area for the Wernicke's sensory speech. And it has also two lines, superior temporal line and inferior temporal line. Now the internal surface. The internal surface has inferior sigmoid sinus and superior sagittal sinus, and the opening of the superior sagittal sinus is called the arachnoid pit. Here it lodges the arachnoid granulations, and this is called the parietal foramen. And these structures that we are seeing in here, these structures are mainly medial meningeal vessels. This is prominent because of the veins, medial meningeal veins. It comes to this area by the foramen spinosum. Now it divides into two branches and form the anterior branch of the middle meningeal vessel and the posterior branch. Now the superior border. The superior border, it forms the squamous part of the it forms the squamous suture, and it is a seeded type of suture. And this anterior part, it forms the coronal suture with the frontal bone, and it is also a seeded type of suture. Now the posterior part. The posterior part, it articulates with the squamous part of the occipital bone, and it forms the deltoid type of suture, and it is the deltoid type. Now the inferior border. The inferior border has three parts. Anterior thin part, it articulates with the sphenoid bone, greater wing of the sphenoid bone, and it is a squamous suture. Now the middle part. The middle part, it articulates with the temporal bone, squamous part of the temporal bone, and it is a squamous suture. And then now the posterior part. The posterior part, it articulates with the mastoid part of the temporal bone, and it is temperomastoid suture, and it is a lambdoid type of, no, it is limbus type of suture. Now the angles, it is the antero superior angle, antero inferior angles, posterior superior angle, and posterior inferior angle. Antero superior angle, it is called brachma. Antero inferior angle, it is called pterion. Posterior superior angle, it is called lambda, and posterior inferior angle, it is called asterion. Now the frontally. So what is the frontally? It during development, some parts of the temporal bone are not ossified. It is called the frontally. It is membranous only. So what is the importance of the frontally? It helps to determine the age of the child, and also growth of the brain. And during vaginal delivery, the two parietal bones override each other like this, so it helps in vaginal delivery. And here it forms the diamond shape anterior frontally. This anterior frontally, importance of the anterior frontally is it helps in the intracranial fossa, intracranial pressure. So if it is decreased, then it indicates the decreased pressure because of the dehydration. But if it is bulged, then it indicates the increased pressure. Then cerebrospinal fluid is collected from here. And then also superior sagittal sinus is access of the sagittal sinus can be determined in here. Then the anterior frontally closes at 18 months or 2 years of age. The posterior frontally and the sphenoid frontally closes at 2 to 3 months of age, and the mastoid frontally it closes at 12 months of age. So this is all for the parietal bone. Thank you.